Hi, this is Chuck Gallagher, and my guest is Valda Ford. Valda, you have an incredible program, Sex is Not for Sissies, amongst other programs that you do as a speaker within the National Speakers Association. That's how our connection has taken place. And because of your work as a registered nurse, your multiple master's degrees, the work that you do in the public health arena, today we're talking about men's health. And particularly prostate health. And I know in talking with a number of men over the years, how do I put this without sounding dumb, but we know we have a prostate. We don't really know what it's for, kind of like we don't know what our appendix is for or our tonsils are for. We just know it's something we need to pay attention to. So kind of guide us through what the prostate is, where it is, and why it's important.
Okay, well, the prostate is a reproductive gland that is located beneath the bladder and right at the penis. So the important thing is that it allows men to have erections. It allows them to release the semen that comes from the testicles through the vas and out. So with the prostate, it is one of those things that's very important to men's sexual health and also to urinary function.
Okay. Well, I know, and not again to be funny with this, but people will get confused. We have a prostate. We can be prostrate. Those are two entirely different things with entirely different meanings. But I think most men, well, let's put it this way, initially take for granted that it's an organ just like any organ and it always functions until we run into issues or problems with the prostate. Right. So what are some of the things that we might look for that would give us an indication that perhaps we need to have some medical attention?
Well, the prostate is one of those organs, like many organs in the body, that may not give us any immediate symptoms if there's something wrong. But when there is a problem with the prostate, it's typically having to do with the ability to urinate, because if it swells, because it's right there at the urethra, it can squeeze it so that urine can't pass through. Okay. That can also cause urgency or frequency. It may have a reflection on the ability to have an erection, and sometimes it can cause pain, but most of the time, in the early stages of prostate problems, there are no symptoms. That's why it's critically important to have a great relationship with your primary care provider so you can get regular exams, and you can get regular digital exams or a PSA, which is a prostate-specific antigen test.
Okay, so let's talk about for a second regular exams before we end this segment. I think most people would assume that an annual physical is preferable for most folks. And if you're a guy, then the truth becomes at some point in time, when you have that annual physical, as you referred to it, there's the digital rectal exam, or for us guys, that's when they say, okay, now I'm going to put on this rubber glove, we're going to put some lubricant on, and son, you're going to need to bend over the table here. And we're sitting there thinking, why are you wanting to put your finger up my butt?
Right. Well, the important thing is that the prostate will show you sometimes on a digital exam with the finger, with a latex glove, that it is larger than it should be, or that it has some nodules, some little bumps on it. If the doctor should feel that, then they would want to do more tests, like the prostate-specific antigen, which is a blood test. But that regular exam should include, for men, a digital rectal exam pretty early so that the doctor can get a baseline of what you're like so you can stop being afraid of it, number one.
Right.
It's simple, it's easy, it takes 30 seconds.
Right. So for the series that we're doing on men's health, and especially prostate health, this helps identify what it is. We're going way down the rabbit hole in a variety of ways to talk about in a practical application exactly the things you need to know. And part of that is because with your background as a nurse in the health arena, And my background as a prostate cancer survivor, we know that lots of time there's misinformation or not enough information that can help men make intelligent decisions so that we can live a healthy and productive life. So stay tuned with Valda Ford. My name is Chuck Gallagher, and we will be back with more information about men's health and prostate health.